3, 2, 1.
Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth, now being broadcast each Monday and Thursday at 12 noon. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here today live for update number 57, coming to you live on Thursday, June 11, 2020. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today, Ken Tavares, Matt Muratore, and I are joined by a panel of participants. They include Dr. Phillip Triffletti. He is an attending physician, primary care physician at Beth Israel Deaconess. Dr. Mark Wilson, he's the active professor emeritus, University of Michigan School of Public Health, Department of Epidemiology. Christopher Smalley, senior director of marketing and communications, Beth Israel Deaconess in Plymouth. Robert Eisenstein is the senior living consultant. Jack Cocio is the chief executive officer, South Shore Community Action Council. Stephen Cole, executive director, Plymouth Regional Economic Development Foundation. And we're going to go to Ken Tavares, chair of the Board of Selectmen. And Ken, we continue to be busy responding to COVID-19 over 90 days out.
We certainly do. I mean, you and I have been rushing from one Zoom meeting to another this morning, as I know others on the panel do that on a daily basis also. There is so much going on. And from the Board of Selectmen's perspective, we have been working and holding special meetings to process the restaurant requests for outdoor dining through the staff on the fourth floor of Town Hall. They've done a magnificent job, Lisa Johnson, Chris Badeau, getting the requests in, making sure that they've been all properly reviewed and have the right information for the board to act upon. I'm very pleased with how that has been going and the results that we're starting to see in the downtown. Also, we are working on the traffic pattern for the downtown. Had an interesting discussion with the Chamber of Commerce today as to the planning of that. We certainly expect in a week and a half, 2 weeks to have the proper barricades up and signage in place to make the downtown safer for the outdoor dining. Also, I want the community to know there's been a great deal of discussion about a virtual town meeting, and that on Tuesday at the Board of Selectmen's meeting, I intend to put a motion forward to go with a virtual town meeting on August 10th. Coming from a meeting earlier today, I can certainly understand the need for training and preparation that we would have to do. But as the moderator has advocated, and I agree with him, it is certainly important not to assemble everyone in the same room, and that we need to do this virtual. With the training, I know that the town is up to it and the town meeting members can do this. Back to you, Mr. Moderator.
Thank you. Ken Tavares is chair of the Plymouth Board of Selectmen. You can send us questions to plymouthinfo@pactv.org. And as a follow-up, on Tuesday, I did present at the Select Board meeting a request to have a virtual town meeting. I will return next Tuesday, and regardless of the action of the Select Board, I will be issuing a fifth declaration to continue the Plymouth annual and special town meetings to Monday, August 10 at 6 p.m. And at this time, we are continuing to work each day planning and preparing for training and practice for a virtual town meeting. But now we're going to go to our daily health segment, and we have a number of experts today. We're going to begin with Dr. Phillip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Thanks, Steve. It's glad to be back again. Happy Thursday. What I'm going to do today is a little bit of fact checking, as you'll often see on broadcasts, regionally and nationally. My stepdaughter, unfortunately, was planning to get married in August, and we had a destination wedding planned, and she had to cancel it because of the pandemic. And of course, she's quite sad about that. But then, she was talking to me this week and saying, I'm mad because it seems like people are opening up and doing more things. And did I really need to cancel the wedding? And of course she did. But, and it is sad, so many people are missing out on things that they had planned, graduations and other kinds of celebrations. It's very unfortunate, but I do think it's the right thing. And so I did want to talk a little bit about that. She says, some of my friends don't wear masks and they go out to restaurants, and, it just seems like, people are, not really following all the procedures to try to minimize infections and flatten the curve, et cetera. One of the facts, of course, that came out this week in the media was the World Health Organization. There was some mention of whether or not people actually were spreading the virus without symptoms. And of course, we've defined patients that are asymptomatic and pre-symptomatic. Asymptomatic means the person never gets symptoms and spreads the virus. The pre-symptomatic would be when people are contagious, but before they get sick, they can sometimes be infectious for several days. And I think that's why this virus is so tricky, and why I like to call it the sneaky virus, is because I think a lot of times that's how a lot of the spread is happening, that continues to perpetuate the virus in the community, is because people don't have symptoms and they're sick. So I think when you look at the research on that, there are some studies we've done here, in Boston area, where maybe 2.5% of people in certain communities were infected but felt fine and didn't know it, so they were spreading virus. And then there's other studies from China last winter where the rates, I think, were around 6%. So I think we do have some pretty solid evidence that people can spread the virus without symptoms. So I think we should debunk that myth and say, yes, it can happen that way. And that's part of the reason we have all these different, policies and procedures we're recommending, to, prevent further spread, until the numbers come way down. A second thing that came up in the news this week I thought was very interesting was a study, I believe it was out of Britain, and it showed that many of the strategies that are being employed, including wearing masks, have significantly flattened the curve, saved, worldwide, millions of lives have been saved really from all of the efforts that we're putting in, both here in the United States and as well as other parts of the world. So I think, we're getting more and more evidence that even though there may be many painful consequences to, all these different social distancing things we're doing, it really is saving lives, both here and elsewhere. So I would encourage people to continue to do these things. If you look at the Tracking the Curve app, and I'm sure others here will talk about the numbers, we were having at the peak in April, 2,000 or more new cases reported per day of COVID-19 in Massachusetts, and now it's down in the 200 to 300 range. I wish we would talk a little bit more about what, how many is a safe number. But, I think part of the problem with a number that's reported at 200 to 300, epidemiologists, I'm sure, and we can see what Dr. Wilson has to say, would often say that what we're measuring is probably just the tip of the iceberg. And so if we're measuring 200 to 300 in Massachusetts per day, it may actually mean that, 10 times that amount or 20 times that amount, maybe, 2,000 or 4,000 people are actually new cases per day that we're not finding. So, so I would make the argument still that there's still quite a bit of virus, present in the community, and that, we're not ready to be a fully open society yet, and that people should still adhere to all of the guidelines that we're recommending. I'd also like to point out that I've had a big concern about the protests and their impacts on the public health, because I think there's a lot of crowding, not always wearing masks, people yelling, which might, spread more respiratory droplets. And if you're following the national news, you may have noticed a lot of states, I think in the 15 to 20 state range now, are starting to see surges. Some of that they're tracing back towards Memorial Day. And I think as far as the protests, which are more recent in the last couple of weeks, I think we still have another 3 to 4 weeks to be able to see the peak effects of that. But I would still encourage people, if you decide to do protests, to try to do it in a safe manner, with masks, with social distancing, to avoid further problems with spread. Another topic is testing capacity. I've been a little surprised. The number of people performing tests is declining. I think at many institutions like my own, I think that the criteria, many of them that are, I think, coming from Department of Public Health, are still a little bit too strict in terms of, who should be tested. I think we should be doing more testing of asymptomatic folks. I think they're having a pop-up drive-through in Roxbury, which is a great idea, in the next few days. And I think there's also been some encouragements that if you've been a protester and you've been out in gatherings, that you should consider going to get tested. Anybody who's been participating in gatherings, close gatherings, that's where you may have higher risk of getting infected. And so that might be a good time to be getting the nasal swab test to make sure that you didn't get infected. But I think we're going to have to really push our strategies more. We've got a lot of testing capacity, and we should really be looking at where do we want to apply these tests. We've done a lot of testing in the nursing homes, as we've discussed, but we probably should be doing more testing of other groups, first responders, healthcare workers, try to define some other high-risk groups, since we have the testing capacity, to try to find as many cases as we can with the tests we have available. And the last thing I want to talk about was just the vaccines briefly. I've seen now published that there are over 130 vaccines. The vaccine development team at Beth Deaconess Medical Center in Boston, Dr. Baruch, is announced yesterday that his vaccine is going to be ready for trials in humans the end of July. So they moved about 2 months ahead on their schedule. So that's very encouraging. We need a vaccine, really, I would say desperately, to stop this pandemic. So, great job by the scientists putting in all this effort, pharmaceutical companies, government support. I think everybody is really, pushing to get that vaccine ready as soon as possible. And as Dr. Baruch had mentioned, we really probably will need multiple vaccines in order to be able to produce enough vaccine to be able to service, billions of people worldwide. So I'll stop there, and I look forward to questions later in the segment. Thank you, Steve.
Thank you, Dr. Phillip Triffletti. Dr. Phil, your comments are certainly very helpful to those of us that are faced with making decisions for the community, as well as for the community as we plan whether to gather in large groups. But I do have one other question for you right now. You began, Phil, by saying, unfortunately, your stepdaughter is planning a wedding. Now, just to clarify, you're very pleased that she's getting married. It's just the timing during the pandemic. Thank you.
It's all to do with the timing and the unfortunate circumstances. She'd like to have a big gathering, and it's just really not possible right now.
Thank you. Dr. Mark Wilson, welcome. And
thank you, Steve. Unbeknownst to me, it looks like Dr. Triffletti and I are playing tag team here, because I wanted to speak a bit about some of the topics that he just spoke on, and I'll elaborate some. First, starting with a question that I received this week from a colleague. Can I explain the confusion that I heard about on the news this week regarding this asymptomatic discussion around people transmitting coronavirus? This is what Dr. Triffletti was referring to in his first comment. And the reason that this is an issue is that a WHO health emergencies technical lead stated the following, quote, "From the data we have, it still seems to be rare that an asymptomatic actually transmits onward to a secondary individual. And the problem here is it makes it sound as though people who are infected but don't develop symptoms are not spreading the virus to others. And of course, this seems contrary to all of what we've been practicing and the main reason behind social distancing and wearing a mask. So WHO quickly clarified this by saying that there is little evidence indicating that transmission from asymptomatic individuals is widespread. In other words, the absence of evidence is not evidence of absence. And so I just wanted to make a couple of quick comments about what evidence is needed. The first part of this equation, if you will, is we need to know how many people who actually get infected, who are infected with this virus, never develop symptoms. And the problem here is, first of all, we're really unclear on this. There's not a lot of good data, but the data that exists give us estimates in the range of 6 to 41% of people who may be infected but not have symptoms. So this is a huge range, but it's also one that in some ways is encouraging because many of us may have been infected unknowingly and therefore could be protected to future exposure. So the problem is this varies by location, by time of the epidemic, by demographic makeup of the population and so forth. In general, young people and those without pre-existing health conditions seem to be more often asymptomatic with their infections. And with more widespread testing that we now have, especially in these defined outbreaks in prisons or in nursing homes or in meatpacking plants, for example, we can better identify the people with active infections but no symptoms. So this is very good, and it's another reason why having more and more tests in these contexts allows us to do contact tracing and identify which part of the population is actually infected and asymptomatic. The second part, though, is to what extent do these people who do not develop symptoms actually contribute to transmission? Here again, the existing evidence is pretty sporadic because by definition, asymptomatics are difficult to identify since they rarely get tested. The only way to know that they're infected is to be tested because they're not sick, they don't get tested. And so even though there are documented examples, there are few large-scale studies, and they're really too early to come up with reasonable numbers. But most of the scientific evidence that we have suggests that on the order of a third to almost a half of coronavirus transmission actually occurs from asymptomatically infected people. So this is a huge impact. If we can identify which people are asymptomatically infectious and determine that early on, it will reduce their infectiousness to other people. And so the bottom line here, I guess, is that these people, asymptomatic or even pre-symptomatic, are still in close proximity to those who may be at risk. And it's all the more reason to keep your social distance, to continue to wear your mask, even if you're feeling fine. Otherwise, you may be unknowingly infecting other people. Okay, so there's another related question to this that I'll just quickly comment on, and it is, are masks still important even with this week's phase 2 reopening in Massachusetts? For the reasons I just mentioned, absolutely yes, critical. It's even more important in some ways to continue wearing a mask and keeping social distance with so many more people now in closer contact and sometimes letting down their guard, in quotes here. In many settings, it's not only advisable, it's even required. And so with these new rules in phase 2, everyone should always have a mask handy in case you can't keep a social distance. And this is really out of respect for your neighbors and your fellow citizens. Do it for them, even if you don't feel that it's necessary for you. Dr. Triffletti also mentioned the new report that came out, and I'll just comment in addition to what he's already said on a few noteworthy issues. One is that this appeared in one of the world's most highly regarded scientific journals, Nature is the name of the journal, and it was an analysis of 1,700 reports. These are reports from local, from regional, from national interventions against the pandemic. And they include things like lockdown, closure, social distancing, face masks, et cetera, et cetera. And they came from 6 countries: China, South Korea, Italy, Iran, France, and the US. So this is a really huge study. And as Dr. Triffletti said, I'll cut this short, the anti-contagion policies substantially slowed the growth of transmission. And this is really important because it's the first very convincing, widespread global evidence that what we've been doing, all of what we've been going through, what we've been suffering through in a sense, to reduce transmission has been effective. The report estimated that across these 6 countries, interventions prevented or delayed on the order of 62 million confirmed cases, which corresponds to averting roughly 530 million total infections and a corresponding number of deaths. So it's really huge impact that we're observing here now, and we have evidence for. And this is a global impact that in settings where the social distancing and other measures are being adhered to, the impact is enormous. Finally, I also wanted to just briefly mention my opinion about whether the anti-racist protests might lead to a spike in cases. There has been less social distancing, of course, we've seen that, but many protesters are still wearing masks. And so this is likely to lead to some new cases. What's going to be challenging here, though, is if we try to evaluate how many are due to the social distancing, it's difficult to entangle this from some of the other changes that have taken place with new states opening in some states where transmission is on the rise, even at the same time as transmission is on the uptick. So we won't know exactly how much, but the good news is that most of the protesters, who I'm very pleased to see, were exercising their right to peacefully protest against racism. We're mindful of the COVID risks, and we're trying to do as best they could to avert that transmission risk. So let me stop here, and I'd be happy to answer questions later on in the segment.
Thank you, Dr. Wilson, professor in the Department of Epidemiology, University of Michigan. Dr. Wilson, your comments again are great reinforcement. Yesterday, I participated in a Board of Health meeting for the town of Plymouth, and I asked them about risks, as you've talked about, for a large gathering, and they gave me a risk hierarchy, which should be common sense, saying the highest risk would be gathering indoors, less of a risk by gathering outdoors, but still a risk, and of course no risk if you have a virtual gathering, such as we're doing today. And we welcome Christopher Smalley. Welcome.
Thank you, Steve. Always a pleasure to be on your show, and thank you to Drs. Wilson and Triffletti for your clinical comments around COVID-19. Locally, here at the hospital, Beth Israel Deaconess Hospital in Plymouth, by the numbers, we have 11 positive COVID positive patients currently as inpatients and 34 suspected patients. So a total of 45. The numbers are coming down, as the doctors had mentioned, and I think that's a good thing for everybody. And again, to reiterate, the social distancing and the wearing of a mask is critical to control this virus. As the Commonwealth has opened up phase 2, so has Beth Israel Deaconess Hospital in Plymouth. We're following many guidelines by the Massachusetts Department of Public Health, as well as our own health system, Beth Israel Lahey Health, in the reopening of phase 2, as we call it, for our hospital and all the hospitals in the system. So what does that mean to the listeners and to the viewers? What that means is that elective surgeries, other types of procedures and treatments have started at the hospital. All of them are based on a priority scale. So those individuals who have urgent elective surgery needs, obviously they would go first, followed by all those that are non-urgent. Many patients are being called right now as we speak to schedule those appointments. And when a patient is scheduled, as well as for visitors coming to the hospital, I'll get to that policy in a second, there's a 3-point system check. So what that means is that when a patient is called, they're screened for COVID symptoms. 24 to 72 hours before their surgery, they would be called again to be screened for symptoms, and again the day of. If they show any signs of those symptoms, they would obviously be rescheduled for surgery. Lots of people have been calling the hospital asking about the visitation policy. We have lifted it, so now we have a limited visitation policy. And what that means is that from 11 a.m. to 2 p.m. During the week, every day, we will allow visitors, one visitor per inpatient, and then again from 4 p.m. to 7 p.m. If you're a surgical services patient, you can have somebody drop you off and pick you up. Pre-COVID, those escorts or patient visitors could stay in the surgical services waiting area, but because of all the enhanced safety measures now in place, we have taken the surgical services waiting room offline, if you will. And if you're an outpatient patient or ambulatory, as we call it, you're allowed to have one patient come with you to your visit. If there's not enough room in the waiting area, wherever you may be going, those escorts or visitors would be asked to wait outside in their car, and they would be called when they need to come and pick up the patient. As far as safety goes, everybody that's coming to the hospital, visitors, patients, employees, are all being screened for COVID-19 symptoms. Everybody has to wear a mask at all times. So if you're a visitor coming to the hospital, you will be screened. You could be turned away if you have COVID-19 symptoms, but you would be given a mask if not. So we just want people to know that. If you don't have a mask, obviously the hospital will provide you one. And social distancing will continue to take place throughout our hospital. As people come back for services, they'll notice throughout the hospital social distancing signage, sections on the floor where people have to stand, no different than if you were to go to a restaurant or a supermarket. We're following all those procedures at the hospital, and social distancing is what we need to do. For other updates, we would always let people know they can go to our hospital's website, and that's just bidplymouth.org/COVID updates. And to learn more about all the safe care initiatives that are happening at our system and at the local hospitals, they could go to bilh.org/safe care. So that's pretty much everything in a nutshell at the hospital. We're back open for business. Not that we ever closed, but we are doing elective surgeries now and procedures, but we do have the limited visitor policy, which I can remind people at the end of this call, or video show, sorry. So that's my report from the hospital. Things are looking good, and we appreciate the support of everybody on this call, as well as the community of Plymouth and the surrounding communities. So thank you.
Christopher Smalley is the Senior Director of Marketing and Communications, Beth Israel Deaconess. And today we welcome back Robert Eisenstein. He is a Senior Living Consultant. Welcome, Bob. And unmute yourself, Bob, and join us.
He's got a bad mic. He is unmuted.
You're unmuted. We're not hearing you, Bob. I don't know if you can correct the mic. If not,
Can you hear me now?
We can
Yeah.
hear you. Thank you. Go ahead.
All right. Sorry about that. I have a new laptop. As the doctors were speaking, I actually thought of the fact that, and we have some very, very positive news this week to report on the numbers, which I'll get to in a minute, in nursing homes. But we may want to collaborate offline. The nursing homes would be a perfect incubator to look at all of the precautions that the doctors were just talking about, because it's a very controlled environment. And although we started late, unfortunately, and had, too many deaths, we've said before, the deaths are unfortunate all the way around. But it's very clear that the precautions are working in a very, very positive light. I did a little analysis week over week, going back to about May 14th. And the increase in number of positive cases week over week was averaging about 1,500 new positive cases. And we have almost about 90% mandatory testing going on right now in all the facilities. Last week, from June 4th to June 11th, the number of positive cases was 741, with an increase in testing by almost 5,000. So as the doctors know very well, that's a very positive sign. That means with increased testing, but a decrease in positive results. Obviously, the things that we're doing are working out very, very well. And just to give you some of the current numbers as of week ending June 11th, we have a total in positive cases of 22,526, again, which is almost an increase in half week over week of what it had been previously. And the really positive news is the decrease in deaths. Week over week, we were averaging somewhere to 350 to 400 times in the number of deaths. Last week, from June 4th to June 11th, the number of deaths in all the long-term care facilities was 224. So that's a significant decrease, and exponentially, we hope to see those numbers, all going in the right direction. The good numbers are coming down, the bad numbers are stabilizing, and that's a very, very positive change right now. What's happening on a bigger level, and I can tell you empirically, because we're involved in staffing rapid response teams and emergency staffing for facilities, and that also has stabilized. I've been in the weeds on scheduling staffing for facilities all over the state. And just within the last week, the number of requests we've had have decreased tremendously, almost to zero. And what's happening is, as we've talked about before, every time there's positive increase in residents on testing, there also is a positive testing increase on staff, and they have to be out for 7 to 10 days quarantine. And so they're now finally starting to come back to work, being 2 test negative and symptom free. So many of the facilities are starting to ramp up with their staffing. I think the challenge going forward for nursing homes specifically is going to be how to stabilize and encourage these precautions to be a permanent fix, because the testing, both doctors mentioned the importance of testing. We're talking through DPH and CMS right now on how to mandate or continue as much as possible a mandatory testing protocol for nursing homes. Obviously, it brings up all kinds of insurance questions, who's going to pay for that. But everybody now realizes that the testing has to be done on a regular basis, the precautions that we're doing. We have opened up for visitation with very limited, all folks who are negative are allowed to have visitors outside with up to two visitors and also wearing masks. So that's starting to work. As far as when we fully open up, the numbers are so positive right now. I think all of us are just going to be concerned, as the doctors mentioned, keep the precautions in place for as long as possible till we see them come down even further. So we're very pleased. This really does look like it's a banner week in terms of the metrics going forward. And some of the facilities have now passed through their 3 audits. There's a series of 3 we call them COVID compliance audits that everybody has to go through. And they're starting to see the enhanced funding as a result of their positive results. One nursing home in particular I know of had a perfect score of 28 out of 28 on all 3 audits. And Medicaid is now offering enhanced funding, sort of a pay for performance. And so that system seems to be working very well. So all in all, positive. We want to see the trends continue. And I'm always available for any questions at the end.
Thank you. Robert Eisenstein is a Plymouth senior living consultant. We now welcome back Jack Cocio. He's the executive director for South Shore Community Action Council. Jack, you have some news for us?
I do, but before the news that I intended to give to you, I have to give you other news as well, based on the fact that Phillip indicated that he has a wedding that's being postponed. My daughter is getting married this Saturday morning, Saturday afternoon, and it's going to be a small wedding, and most of it is going to be by Zoom. And those of us that will be at the church will be separated pretty well and be wearing masks and things of that nature. Some of the biggest questions will be when I walk her down the aisle, will I hold her hand? Will I give her a kiss? Things like that have to be answered, and we'll have the practice tonight. So it should be a lot of fun. We'll be very careful, and we're very excited for her. But really, the reason I came was for for something else. We've been trying for the last month at South Shore Community Action Council to get some group that has been on Cape Cod preparing meals for families and doing a drive-through at various locations to come to Plymouth. We know at South Shore Community Action Council that the COVID pandemic has put a significant stress on families, especially as it relates to food right now. And so we wanted them to come to Plymouth and help us out. So I'm going to just read the announcement that the Plymouth North High School is putting out. I think it describes the situation pretty well, and then I'll elaborate just briefly. The Cape Cod Family Table Collaborative is coming to Plymouth Tuesday, June 16th from 4 to 6 p.m. at Plymouth North High School. To support families in need, local Cape Cod chefs partnered with the American Culinary Federation and the Cape Cod Culinary Incubator to create Cape Cod Family Table Collaborative, providing nutritious prepared meals to those in need during the COVID-19 pandemic. In partnership with the South Shore Community Action Council and the Cape Cod Family Table Collaborative, the Plymouth Public Schools invites you to a drive-through dinner event on Tuesday, June 16th, 4 to 6 p.m. at Plymouth North High School. If you're experiencing hardships due to the pandemic, please join us and pick up a prepared family meal and bag of groceries. This is a drive-up event. Volunteers handling outtake will be the dinners and groceries will be wearing appropriate face coverings and gloves. I think it's pretty significant, and I wanted to mention to you that what we've seen is what they've been doing is preparing a tray of food that includes protein, starch, and vegetables for a family of 4 for 2 days. And when people drive through, they'll receive that. If they have a family of 8, they'll receive 2 trays. And one of the things that we wanted to do at South Shore Community Action Council, we have a very large food resources program that does over 500,000 pounds of food each year out to the communities. And this year, by the way, we're doing double that amount at a rate of double that amount right now. But what we're going to do is put together a bag of groceries so that when a family drives through, not only will they receive the meal for the next couple of nights, they'll also receive a full bag of groceries as well. It should be a fun event, and we're just hoping for good weather. We anticipate that we could have as many as 250 or more cars that will drive through. So if you're planning to come, try to get there early. So that's basically it.
Thank you, Jack Cocio. He is the Chief Executive Officer, South Shore Community Action Council. Please send your questions to PlymouthInfo@pactv.org. We're now joined once again for our business segment with Stephen Cole. He's the Executive Director, the Plymouth Regional Economic Development Foundation. Welcome, Steve.
Well, thank you, sir. It must be Thursday because I'm back. So I'm so glad to be here. Just pulling up my notes here. There are some things I think some folks need to know for today. The Dow Jones and the S&P fell for the second straight day, and I just saw an indicator come across my phone a moment ago. It looks like the Dow just dropped another 1,050 points, but there's still time left in the day. Consumer prices, which is a measure of inflation, fell for the 3rd straight month in May. We should see some of the June numbers coming out early July, so we'll see if that continues in its decline. The Fed Reserve met yesterday, and I think it's important that folks at home understand or know that they are predicting that the GDP for the nation will fall about 6.5% in 2020. They are expecting that it will rebound in 2021, but frankly, it's only going to be a 5% rebound, and that leaves a deficit of about 1.5% or so that we can expect. Frankly, 3.5% because you figure growth is supposed to occur at 2% each year. So some good news, though. It does appear that the Fed does not intend to raise any interest rates, at least until 2022. There are some positive signs in the recovery, as Bob was just kind of talking about from a health perspective. The economy is also starting to show some positive signs. Plane travel, we had a low of only 90,000 travelers on April 14th. We are starting to see, as of last Sunday, that number has increased quite a bit. There were 440,000 travelers processed at U.S. airports, as being reported by the TSA. Although that sounds like a significant jump, the fact of the matter is that's just 17% of what the year-over-year travel rate was last year. I think all of us noticed that the gas prices in April fell quite a bit, and we saw that they were fairly agreeable, but we are starting to see, of course, some of those prices creeping back up as demand is starting to be met. But that's actually part and parcel because people's behaviors are actually starting to change to what it was prior to the COVID lockdowns. Apple has this mobility data sets. If we have cell phones, we're being tracked. So they release those numbers, and they can see that folks are actually approaching their pre-pandemic driving levels. The number of people applying for unemployment benefits peaked in mid-March, and although the unemployment level remains high, we've actually seen that the number of applications have declined for now the 10th straight week. We're seeing some movements in what I like to refer to as, the Freakonomics indicator, those things that necessarily don't tell us the full story, but they do give us a sense of what the pulse is for consumers and behavior. One of those such indicators is dentist's offices. Generally, when people don't have employment or insurance, the dentist is one of those things that few Americans will visit. And actually what we saw from the American Dental Association is that 45% of dentists laid off their entire staff by mid-April. However, as of the first week in June, 77% of dentists' offices have actually rehired their full staff. So I think we're starting to see some positive movement there too. But frankly, be prepared for this to take a while. If you're the type to wait around and see what happens, well, the gravy train is, as I understand it, scheduled to end at the end of July. And if you're not ready, you could very well be left behind in this new economy. You've heard me say it 1,000 times, or at least 57 times on this program, right, Steve? We've done this 57 times, or at least you and the handful of other folks have. But you've heard me say this before. If you think that your job will not be there when you reopen, we're only in phase 2 right now, but it's really not something you should probably wait around and consider how you're going to respond to this. As I said, the gravy train is ending. Now's the time to think about the type of job you want to create for yourself, your friends, your family. What kinds of problems do you want to solve? What kind of business, therefore, do you want to start? And if you don't know where to begin, give me a call at the Plymouth Foundation. I'll be very glad to help you out. We have great contacts with the National of USEVA, the local chambers of commerce, Mass Development, other state offices like Morty and Mott. Morty is Mass Office of International Trade and Investment. Mott is, of course, Travel and Tourism. And frankly, I'll conclude this part of the segment with because I spent a lot of time reading to my nieces and nephews during this time, and because of something that Dr. Triffletti said about his the impending wedding, I'm going to shelf Mark Twain today in favor of a more profound person from our history. Mr. Winnie the Pooh once said, "Rivers know this: there is no hurry. We shall get there someday." Now, if you're a bit of an Eeyore, you probably have a different perspective on things, but Mr. Pooh is closer in philosophy to Kafka, who said that patience is the only true foundation on which one's dreams come true. So if you have dreams, if you're not sure that the normal life that you're familiar with will be there waiting for you by the time we get into phase 4, now is the time to start thinking about the type of business you want to start. Thanks, folks.
Thank you, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. And Matt, that's a lead-in to you for your daily update from the state. This is number 57, plus the other 3 we did. We're on to number 60. Go ahead.
Is there any way I could start going before Stephen Cole in the future, Steve?
It could be
I don't know how you
arranged.
follow Winnie the Pooh. Yeah. Well, anyways, good to see everyone. Great input again. Love having all these folks on Thursdays. Great information. As both Dr. Triffletti and Dr. Wilson were talking about, the numbers are looking great, and the wearing the mask is the key to this whole thing. And people, I know you. If you watch national news, I try not to, but you see people walking around without masks. It's a problem. You still need to wear the mask in public. That's what's making the numbers here in Massachusetts go down. We are now at, with the amount of testing that's been done, which is over 668,000. To date, we are now under 5%. We're running 4.8% of those tested now are being confirmed with the coronavirus, which is, as Dr. Triffletti said back at mid-April when we were at the height of this, it was 28% of those being tested every day were confirmed with the virus. So the numbers are looking very good. If you look at the 7-day weighted average for the number of positive tests in the last 30 days has gone down 86%. At the same time frame, the last 30 days, the 3-day average of patients in the hospital have gone down 61%. We are now down to 1,344 COVID-19 patients in hospitals within the Commonwealth. And again, at the height of this, we had over a month ago, or back in mid-April, was over close to 4,000. The ICU beds is only now on 319 in the Commonwealth, so that's looking good. The surge capacity, that was the additional beds that were added in the Commonwealth to anticipated the surge. That's dropped by 81% in the last 30 days. And the 3-day average of deaths over the last 30 days has dropped 78%. We're still having deaths, but dropping at a lower rate at this point. And as Bob indicated, the numbers are looking good in long-term care facilities, but we're still looking at the average amount of the total deaths, which are 7,454, have all occurred, or 62% have occurred in long-term care facilities. With regard to the opening, I just want to briefly touch upon it. We're getting a lot of calls from folks looking for nail salons and pedicures and daycares and indoor dining. These are all part of phase 2, but we're only in week 1 of phase 2 at this point. So the earliest we will probably see any of these opening would be the week of June 15th, next Monday. But my best guess in what I'm hearing and what I'm seeing is probably won't be till June 22nd for these, but stay tuned for those. I know folks are getting anxious to get the pedicures and the nails done. But daycares are definitely looking like the 22nd that they will be opening up. And I think indoor dining looks like that may be right around that date as well. So stay tuned for that. The governor was just on and just announced a couple of things that Jack will be interested in. There's a food security grant of $56 million he just announced, and that is for food banks. It's also is to have access to food for farmers, fishery industries, et cetera. There's a lot to it. It's a good amount of money to help keep the food system going. Ensure that there are connections between, say, for instance, the fishermen and where the fish actually and the lobsters actually go. So there's more information coming out on that. So take a look at that, and the grants will be available very shortly, later this week, beginning of next week. And also, Ken and Steve will be interested in this, so pay attention, Steve. There will be a $5 million, $5 million street grant that has just been announced by the governor. The grants will be from $5,000 to $300,000. These they'll be available on Monday, starting Monday. So you want to jump on these right away. This will be through the town, Ken. So the municipalities will need to apply for these. And what this is, it's going to assist the small businesses that are on Main Street, or in this case, on Main Street, where you're going to be closing half the street, talking about closing half the street and having people on sidewalks. What this $5 million grant is to help the municipalities offset the costs to ensure that the streets are going to be safe for people to be walking and dining in. So I would encourage the town to take a look at that and file for that grant on Monday. So that was some good news. And again, just a shout out to Lisa Johnson, who's always done a magnificent job with licenses in this town, and to the board for being so proactive and really helping out the restaurant community. I'm getting a number of tweets and texts and calls from folks that are just so appreciative of what the town is doing to help them open up as quickly as possible and meeting as quickly as they can. So I just want to let people know that. So again, the $5 million street grant will be available on June 22nd, a week from Monday, and the food security grant will be opening up very shortly as well. So keep an eye out for those. And that's my update today, Steve.
Thank you. That is Plymouth Representative Matthew Muratore. He'll be here to answer questions. Send them to PlymouthInfo@pactv.org. And on Monday, we will return. We will have guests joining Ken, Matt, and me. They include Sarah Cloud. She is the Director of Social Work and Behavioral Health at Beth Israel Deaconess. Michael Jackman, he is the District Director, Congressman Keating's office. Heather Cosby, she is a Plymouth CPA. Michelle Brady, Director of Elder Affairs for the town of Plymouth. Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. We're going to go right to our questions today. The first question is for Ken Tavares. And Mary writes that she's seen a lot about beach stickers, but how do I renew my dump sticker? Ken Tavares.
Ken's on the phone.
And Ken's on the phone. Welcome, Ken.
First off, can you hear me?
We can hear you. Go ahead.
Yeah, sorry, folks. Okay, power went out, and so I'm trying to get back in, but it's not going to happen. I had the same question that our viewer did, and the Board of Selectmen will act on the cost of the stickers on Tuesday, the 23rd. At that time, after the rate is set, I will be asking for an extension and grace period that will be reasonable so that people can go online and get the stickers. We certainly will have more to say about that in the next few days. Thank you.
Thank you, Ken Tavares, Chair of the Board of Selectmen. Next question is from Jane. Dr. Phil, could you comment on the studies that have shown that people with type A blood type are at a higher risk of contracting the virus and having more severe complications as well?
Yes, thanks for the question. Yeah, unfortunately, I haven't really followed the data much on the blood typing, that would look at these different rates of infection. I don't know if Dr. Wilson can comment on this.
Thank you, Dr. Wilson. Jane also asked that both of you comment. Are you familiar with any studies regarding people with type A?
I'm not, and yet I think it's important to distinguish between blood type and risk of being infected, blood type and risk of having symptoms of any sort, and blood type versus severity of symptoms. And so frankly, I'm not sure whether or not blood type affects any of those, but that distinction is important. And I think it's likely that there's little effect on the exposure risk, and it's more likely to be with regard to the severity of symptoms.
Thank you, Dr. Wilson. In preparation for our town meeting, I did contact Barry de Blasio regarding people with disabilities, and this is not exactly on point. The question was whether or not a person with disability, are they at a higher risk? And he quoted the CDC by saying that most people with disabilities also are not inherently at a higher risk for becoming infected or having a severe illness from COVID-19. However, people with disabilities might experience higher rates of chronic health conditions that put them at a higher risk of serious illness and poorer outcomes from COVID-19. So that is with respect to people with disabilities, a little difference from blood type. But at this time, we're going to go back to our roundtable and circle back to Dr. Phillip Triffletti. What do you want people to remember today?
Well, I want to still reinforce everything we've been talking about these last few months, which is, social distancing is important. It works. The necessity of wearing masks, we've, shown from research that this is also decreasing the number of infections. We should always emphasize the hand washing. And I've mentioned on previous broadcasts that, people who wash their hands at least 10 times a day have about 50% less risk of getting COVID-19. So I think you want to continue to do all these things, even though we're in phase 2 and we're able to do more than we were, which I'm very excited about personally, and also for the community. We want to stay the course, be patient, and just continue with all of the flattening the curve efforts that we've been making, because there still is significant virus out there in the community in Massachusetts, and we want to get those numbers down even further. Thank you.
Thank you, Dr. Phillip Triffletti, primary care attending physician, Beth Israel. Dr. Wilson, what is the takeaway today?
Well, let's remember that despite that we're in the middle of a pandemic, life goes on, just sometimes under very different conditions or circumstances. People apparently are still getting married. That's good. Neighbors are still interacting. Community relations continue. Many businesses are functioning, but differently. Poverty persists and is even worse. Social tensions are more out in the open, and that may actually allow for positive change. So we're in an unprecedented global event, and we will get through it, but our lives are likely to be very different and probably indefinitely into the future. So many of these changes, I think, are likely to be for the better in multiple dimensions of our existence. And hopefully we will become more considerate of others with these changes.
Dr. Mark Wilson is a University of Michigan Professor Emeritus, Department of Epidemiology. Christopher Smalley, what can you tell us?
So I think the takeaway for the viewers is that, the hospital, like the Commonwealth, is going through a phased reopening. We're in phase 2, so we're starting to do elective surgeries and treatments and procedures. We would ask our patients as well as visitors to be patient with the process, the screening that will happen whenever anyone comes to any office at the hospital, be it on campus or off. I said this last week, and we've been saying it in other interviews. We've safely been treating COVID-19 patients the last 3 months. We are safely treating non-COVID-19 patients at the same time. And as a hospital, we're going to continue to safely treat patients because that's our main priority and focus is patient safety. So Beth Israel Deaconess Hospital, Plymouth, it's still a very, very safe place to receive care, even during this pandemic. And that would be the takeaway for the viewers on the show today.
Thank you, Christopher Smalley, Senior Director of Marketing Communications, Beth Israel Deaconess. We've come a long way from the start of this pandemic. Robert Eisenstein, what should we remember today?
I think two brief messages. One is it is very positive news on the way that the numbers are looking right now in nursing homes, but also a word of caution. And I think what we've learned, particularly in the long-term care setting, because of the high transmissibility of the of COVID and the vulnerability of this patient population, we have to be very, very cautious. I've said this before, it is still going to take patience. The reopening, the phases that we're talking about in the business and the community is probably going to be a little bit more of a slow go in nursing homes. And we just ask the public to understand that. And lastly, I mentioned this before, I think there's a lot of concern, or there was, with the lack of information flow and communication. We had a caller asking before, how can they get more information about what's going on within the nursing home? And people are now committing to making sure there's transparency, there's information online about the infection rates, and that's going to be a permanent positive change in nursing homes. So we need to be a little cautious, but we're very hopeful with the positive changes.
Robert Eisenstein is a senior living consultant. Jack Cocio, I've been a fan of South Shore Community Action Council for decades. What can you tell us?
Well, our mission at South Shore Community Action Council is to assist those that are in need or that are less fortunate than we are. And I've been thinking recently about the fact that our Maker intended life to be about love, not violence. And so as you go through the day, think about that, think about love, and see if you can spread a little bit to your neighbor.
Jack Cocio, Chief Executive Officer, South Shore Community Action Council. Stephen Cole, my grandson is a little over 2 weeks old, and thank you for reacquainting me and reminding me about Winnie the Pooh. What else do you have for us?
Well, I'll leave you one more. These kids don't know how to adjust to being home all the time with their other brothers and sisters. So I bought them the series of Alexander and the No Good, was it Terrible, Horrible, No Good, Very Bad Day? Mm-hmm. The point there is, of course, just because they have one bad day doesn't mean they have to have several, or really more than that. But that's not my closing thought. More significantly, I want to remind folks that, in addition to encouraging folks to apply their skills and take charge of their own economic security, I want to remind folks to do what you can to help our small business community. It is our small businesses, after all, that give us the quality of life that we so enjoy. You have until June 30th to send a picture to the Plymouth Foundation along with the $10 entry fee for the Crazy Beard and Hair competition. Some of you have already heard about it. Go on the Chamber of Commerce Facebook page and you'll be able to see some more information for how to enter your picture for your crazy beard, your crazy hair. You can win a $50 gift card to a Plymouth-based salon or barbershop of your choice. And all fees we collect will go to helping small businesses adapt to the new regulations post-COVID. I will tell you right now, our very own state rep has submitted, and I don't know what it's looking like, but he is a front runner for the crazy hair. If you think you can beat Matt in the crazy hair competition, send in your money, send in your pick. Let's get our small businesses back on their feet. Let's have fun doing it. Thanks, guys.
Thank you, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. Matt Muratore, I didn't move you in the rotation. Are you up to the challenge?
Yeah, that's okay. I deal with him enough, so I'll deal with it. First of all, ditto for both Dr. Triffletti and Dr. Wilson's comments. this is great that we're opening up, and people get excited, and people are getting excited, and they're getting out there and eating outdoors and all that. But continue to wear those masks. We do not want the numbers to start going backwards, because then we will go backwards with the economy as well, and we don't want to do that. So continue, staying safe. Continue staying informed by going to mass.gov/COVID-19 and or mass.gov/reopening, which gives a lot more information about retail, restaurants, nail salons, all this information that you'd be looking for. Ask questions by calling 211, get text alerts by texting COVID-MA to 888-777 or COVID-MA-ESP in Spanish to 888-777. And of course, your health questions to bowie.com/mass. And again, thank you to everyone out there who is helping us through this, through the economic health and the physical health. And again, to you, Steve, and big thanks to PAC TV for getting this communication out the last 3 months and continuing. So have a great weekend, and we'll see you all on Monday. Thanks, Steve.
Thank you, Plymouth Representative Matt Muratore, and to all our guests, Dr. Phillip Triffletti, Dr. Mark Wilson, also to Christopher Smalley, to Robert Eisenstein, also to Stephen Cole, and to Jack Cocio. And now we circle back to Ken Tavares, who's here on video again. Welcome, Ken. And you got to unmute yourself, Ken. We can't hear you, so let's see if you can unmute yourself. Ken Tavares, the chair of the Plymouth Board of Selectmen. He's going to be giving us his closing comments as we round out update number 57, our Plymouth daily response and update to COVID-19.
Here he is.
Go ahead, Ken.
Oh, no. He moved again.
There you go, Ken.
He pushed the button.
Ken, push it one more time.
Nope, again.
This is part of our COVID-19 response. We're
There you
dealing.
go. There you go.
There we
There
go. Go ahead, Ken.
Okay, everyone, I'm going to take some advice that I usually try to give to you periodically during these broadcasts, and that's to have patience. It was a good test today, and I think I failed when the power went out. And I'm a little bit disappointed in myself, but it's been a long morning. I'm sorry I missed some great panelists once again, because I respect everyone that's on this panel today. Also, I just want to leave you with, there are new norms. We do need that patience, and it's not easy, as I have probably miserably demonstrated to you trying to get back on. I know Matt Muratore, Representative Muratore, I'm going to be calling you because I heard you say $5 million, and I didn't get the rest of it, but I'll be calling you. And Steve, don't go too far, because you're going to have a new assignment. Want some of that money. Well, anyway, thank you all for your patience. Keep smiling, and as we have said so many times, and I do believe it, we will get through this. Thank you.
Thank you. And Ken Tavares will be back on Monday with Matt Muratore and Sarah Cloud, Heather Cosby, Michael Jackman, Michelle Brady, Amy Naples, Plymouth Area Chamber of Commerce. Thank you for joining us today. I'm Steve Triffletti, Plymouth Town Moderator. Good day.